Hello, my name is Kimmy Haber, and this presentation will address a patient scenario where the advanced practice provider will create concordance with their patient to reach a mutually agreed upon goal. The Psych Nurse Practitioner Standards of Professional Performance are established by the American Nurses Association, ANA, and they serve as a guiding framework for delivering high-quality, person-centered mental health care. These standards emphasize essential competencies such as ethical practice, culturally congruent care, collaboration, evidence-based practice, and effective communication. All of these standards are critical to supporting the therapeutic relationship and achieving positive outcomes in the advanced practice as a psychiatric nurse practitioner. Central to these standards is the concept of concordance, which is defined as a way of working together with people. Concordance goes beyond compliance. Concordance promotes mutual understanding, shared decision making, and respectful partnership between the clinician and patient at hand. This presentation examines the development of a treatment plan in concordance with a patient scenario that integrates ethical and cultural considerations within the framework of the psychiatric mental health nurse practitioner standards of professional performance. The patient is a 23-year-old Caucasian woman who is 29 weeks pregnant and is currently navigating the challenges of both alcohol use disorder, AUD, and post-traumatic stress disorder, PTSD, which she relates has stemmed from a history of sexual trauma. She shares that she drinks a glass or two of wine daily to help manage the stress that she feels during pregnancy. While this may seem like a modest amount of alcohol intake, it may also reflect a tendency to minimize her alcohol use, which can be common in individuals facing stigma or fear of judgment. Downplaying the amount of alcohol consumption during such a vulnerable time such as pregnancy is something that the psych nurse practitioner must investigate appropriately to ensure that the baseline is established while creating a treatment plan. Her experience is complex and deeply layered. The use of alcohol during pregnancy raises serious concerns for both her health and the development of her growing fetus, including the risk of fetal alcohol spectrum disorders, FASD, which can cause low birth weight and potential long-term cognitive and behavioral effects. At the same time, the emotional toll of PTSD may increase her reliance on alcohol as a coping mechanism, while also complicating her ability to feel safe and supported in the healthcare settings. Trauma-informed psychiatric nurse practitioner. Given her trauma history, building trust must be a central focus of care. Survivors of sexual trauma often feel especially vulnerable in clinical environments, and standard medical interactions may unintentionally trigger fear, anxiety, or withdrawal. These dynamics can impact her comfort with treatment and her willingness to disclose sensitive information. What stands out, however, is her clearly expressed goal is a healthy baby. This statement reflects a deep sense of hope and motivation and is an essential foundation on which to build a therapeutic alliance. A trauma-informed, culturally responsive, and concordant approach where she feels heard, respected, and included in her own care decisions for both herself and her baby. By centering empathy, safety, and collaboration, we as psychiatric nurse practitioners can help support her not only in reducing harm, but also in moving forward toward meaningful healing and recovery for both herself and her baby. Treatment planning for her and her growing fetus involves navigating complex ethical considerations, particularly the tension between honoring her autonomy and ensuring fetal safety. As a pregnant adult, she has the legal and moral right to make decisions about her care, even when those choices carry potential risk for her unborn child. This raises important questions about beneficence and non-maleficence. Reflecting upon the fundamental principles of ethics raises questions such as, how can I act in the interests of both the patient and her baby without causing additional harm or violating trust? The principle of justice also comes into play, especially when considering whether her substance use may trigger mandatory reporting laws, which could disproportionately affect women of certain backgrounds and discourage engagement in care. Confidentiality must be carefully balanced with legal obligations, always to minimize harm and preserve the therapeutic relationship. Cultural considerations and factors add further complexity to her care. In some occasional drinking during pregnancy may be normalized, or trauma in mental health care may carry a stigma that discourages open discussions. If her cultural background includes a history of mistrust in medical or mental health institutions, especially related to reproductive rights or substance use, she may be more hesitant to fully engage in treatment. Family dynamics, spiritual beliefs, and her understanding of trauma and healing may all influence her readiness to seek support. It is therefore essential for the psych nurse practitioner to approach her care with cultural humility while remaining open, non-judgmental, and deeply respectful of her lived experience. Integrating these ethical and cultural considerations into the treatment plan not only aligns with the psychiatric nurse practitioner standards of professional performance, but it also strengthens the foundation for a compassionate, concordant, and effective therapeutic alliance for her individualized and holistic care. Developing concordance. Developing an effective treatment plan for this patient requires a collaborative, respectful, and patient-centered approach that acknowledges her autonomy, trauma history, and a desire for healthy pregnancy. A key first step is engaging in motivational interviewing to explore her readiness for change without judgment or pressure. This technique fosters open dialogue, helping the patient identify her motivations and barriers to reducing or abstaining from alcohol use. By creating a safe space for honest communication, the psychiatric nurse practitioner can begin to guide the patient towards goals that are realistic and meaningful to her. Treatment planning should focus on harm reduction and safety rather than immediate abstinence alone, which may cause more undue harm and stress on the mother and fetus. Together, the patient and provider can co-create goals that include reducing alcohol intake, establishing a safety plan, and integrating trauma-informed principles into every aspect of care. Close fetal monitoring is essential and should be coordinated with her OB provider. While medication-assisted treatment, such as naltrexone, may be considered for alcohol use disorder, the risks and benefits must be thoroughly discussed in the context of pregnancy, with decisions made collaboratively. Supportive psychotherapy is also a critical component. While intensive trauma-focused therapy, such as EMDR or trauma-focused CBT, may be best initiated postpartum, connecting her now with supportive counseling or peer support groups can help reduce isolation and enhance coping. A multidisciplinary team approach is vital, involving her OB provider, a social worker, a substance use counselor, and a case management ensures that her care is comprehensive, coordinated, and responsive to both her psychosocial and medical needs. If there are any concerns about intimate partner violence or an unsafe living environment, safety planning should be prioritized, including access to emergency resources and shelter if necessary. Throughout this process, the psych nurse practitioner adheres to the standards of professional performance by fostering collaboration, using evidence-based interventions, advocating for the patient's well-being, and practicing with cultural humility. This patient-led, trauma-informed approach supports not only the patient's goals of a healthy baby, but also her long-term recovery and empowerment. Barriers to treatment. In this scenario, she may face multiple barriers that can hinder engagement and success in treatment. Fear of judgment and concerns about involvement of child protective services are common among pregnant women with substance use disorders, often leading to underreporting and a reluctance to seek help. Additionally, her history of trauma can contribute to feelings of shame and deep distrust toward healthcare providers, making it challenging to establish a therapeutic alliance. Practical barriers such as unstable housing, limited transportation, and financial insecurity may also interfere with consistent access to prenatal and substance use treatment. Furthermore, a lack of available trauma-informed prenatal or addiction care services and cultural stigma around substance use and mental health may leave her feeling isolated and unsupported. To address these barriers, it is essential to prioritize building trust through empathy, active listening, and a non-judgmental communication. Connecting her with community resources that offer practical support, such as transportation assistance and housing programs, can reduce the logistical obstacles. Peer support groups provide an invaluable source of understanding and encouragement from others who share similar experiences. Lastly, ensuring access to trauma-informed prenatal and substance use care tailored to her unique cultural and psychological needs will promote safety and engagement throughout her treatment. Conclusion and reflection. As a trauma-informed provider, my understanding of caring for pregnant women with co-occurring substance use disorders and post-traumatic stress disorder is deeply informed not only by the literature that we're reading and evidence-based practice, but by my personal experiences. Having family members affected by alcohol use disorder and having endured abuse myself, I recognize the profound challenges these conditions create, including both the pain and the resilience involved. This dual perspective strengthens my commitment to approaching care with genuine empathy, patience, and respect for each individual's unique journey. This research has reinforced for me the importance of ethical, culturally sensitive, and trauma-informed care that honors the patient's autonomy while carefully considering fetal safety. Have grown in my ability to develop treatment plans that are collaborative and rooted in harm reduction, recognizing that healing often occurs in stages and within the context of trust. Personally, these experiences motivate me to continually enhance my cultural competence, ethical awareness, and therapeutic communication skills. I am especially mindful of the delicate balance between supporting a mother's right to make decisions and advocating for the well-being of her unborn child. My goal is to create a safe place where patients feel heard, respected, and empowered to participate actively in their care, knowing that trauma and addiction do not define their worth or potential for recovery. Thank you. This is my list of references if you would like to review them. There are some great resources there.